Assalamu alaikum. My name is Mahwish Latif Khan, enrolled with roll number 135 of morning series, and today I have been assigned with the presentation topic that is diphtheria tetanus vaccine of 705 course. Leading towards its introduction. So what diphtheria tetanus vaccine is? In short, shortly, it is called TD vaccine that prevents the patient or person from two deadly diseases that are tetanus and diphtheria. Tetanus and diphtheria both are the bacterial diseases, as tetanus is caused by the Clostridium tetani that enters the body through cuts and wounds, while diphtheria is caused by the Corynebacterium diphtheria, and it spreads from person to person. This vaccine is basically the booster immunization vaccine, and its shots are needed every 10 years to adequately protect against these diseases. And the side effects also include the mild side effects are there, like pain, redness, swelling in the arm. But some people, rarely some people, that are 3 out of 100 people, face the intense side effects like this severe swelling over their arms, but it is very rare side effect. So TD is a booster immunization that is given at the age of 7, not below 7. I'm only talking about the TD vaccine. Further, I'll explain why not below 7. So that's why it offers continued protection from these diseases, and it doesn't protect against the pertussis, that is actually the whooping cough. Though we all know very well that commonly the DTP or Tdap vaccines that are represented with tetanus, diphtheria, and pertussis, that is the whooping cough. But here I'm not covering this whooping cough as it is not my topic. I'm only discussing with the diphtheria tetanus vaccine. So this vaccine is in the inactivated form, as in this vaccine there is no live bacteria, so there is no replication of this bacteria. That is why multiple doses are needed to produce the immunity. This vaccine is not of the single dose. It has to be given minimally with the 3 doses and maximum with the 5 doses. Now, what are the rational use of TD vaccine? TD vaccine is given to provide protection, immunity against the tetanus, lockjaw in adults in 7 years of children or older. As I have told you previously that it shouldn't be given below 7 years of age. But here in this picture, you can see that here with the for TDAP for younger children, and here 2, 4, and 6 months of age is being mentioned, and I'm saying that not below 7 years of age. So I'm only talking about the TD vaccine, that is tetanus diphtheria vaccine. It shouldn't be given 7 years below of age group. But the DTaP or TDAP, that is diphtheria, tetanus, and the pertussis combination of 3 deadly diseases vaccine can be given, but not the TD. So there is a rational use that with here, as you can see in this picture, that for adults every 10 years of interval time period is required. But before this, for the younger children, here we can say them infants or toddlers, so they need 5 doses of this vaccine. It is the rational use of TD vaccine. So what is the irrational use? Basically, as it is a vaccine, so there is no such irrational use of it. Mostly polypharmacy is being noticed or seen among the patients or among the addicted person who consume the alcohol and other drugs. But as it's a vaccines, and furthermore it's a boosted immunization, so no one is going to use as the addictive agent. That's why there is no irrational use of TD vaccine. But though there is not irrational use, but if we enhance or increase the dose of TD vaccine, or we are going towards the frequent dosing, then it may cause some sort of local reactions or cause the allergic reactions. So that might be very difficult for the patient. So that's why this vaccine is not given lonely, especially for infants, Rather, it is given minimum with the 3 doses, that is in a series of 3 injections. Okay, now alternative choices with reasons. As I have focusing over the TD, but what are the alternative choices that should be given if the TD vaccine is not available? So the first one is the TT, that is tetanus toxoid vaccine, which is the alternative booster injection of TD. And this vaccine is only for 7 years of children or older, but not with the adolescents or with the younger ones or for the adults. Then we have DTaP, which is an alternative one for the TD, and it helps children younger than age 7 to develop immunity against the 3 deadly diseases that I have previously said, that is diphtheria, tetanus, and pertussis, that is whooping cough. Then thirdly, we have Tdap, that is TDAP, which is also a boosted immunization given at age 11, not below the age of 11, as that is offers continued protection from above mentioned 3 diseases. So this TDAP is also a very efficient vaccine among the all of the comparison comparatively, but it is typically given once during a lifetime except during pregnancies, and it can be used safely for those 65 years of age and over. That's why I have said that this is the best one, as it can be used safely for those 65 years of age and over, the persons who have a fear of injectables, parenterals, so they are safe with this TDAP, that is Tdap. Now here I have given some brands, alternative brands actually, with reference to the high price. In this slide I have mentioned with the high price. As you can see, the price of this vaccine is far beyond the range of a middle class person, that is Pentexim. Then the Tetatox, which is approximately 50% of 50% off of the Pantamax. And thirdly, with the tetanus toxoid vaccine, which is the cheapest one among these 3. Though it is the cheapest one, but when we are going to compare with the low price one in the next slide, it is also very expensive. But with reference to these 2, that is 3,000 and 1,500, it is the cheapest one. As you can see, I have also mentioned the given the pictures of these vaccines, so you can see very well that the packaging and the company's protocols have given them high price. Otherwise, the main ingredient, or you can say the main active ingredient in all the vaccines, are the same. So here we are going with the low price one. As we have compared, you can see that in the over the high price, the top most is the 3,000, and with the cheapest one it is the 30. There is a huge market difference between all these vaccines. First, here we have Imatat, that is 43 rupees, Tetavax 35, and then Vextet 30. All the names are different as they belong to the brand names of different pharmaceutical companies, so there is no need to worry that which vaccine is suitable or not. All are very effective, but they all depend on the cheapness of the drug, and keeping in mind the socioeconomic point of view. Now, the available dosage forms of TD vaccine. As you know that it's a vaccine, so it has to be available in the ampule and vial form, vial dosage form, as it's a vaccine. And it's a sterile toxoid solution, which is made up of with the sodium chloride solution that's delivered intramuscularly or subcutaneously. It's not given IV, as it's a vaccine, so it is given intramuscularly or subcutaneously. And this vaccination in appearance is a slightly turbid substance or turbid material, and this vaccine comprises purely of tetanus and diphtheria toxoids in range of 0.5 ml dosage, with 4 international units of diphtheria and 40 international units of tetanus toxoid. Okay, so now how we are going to administer this vaccine, or what are the scenarios or what are the situations in which we do prefer to administer this tetanus or diphtheria vaccine. So the proper tetanus doses must be administered to the mother before and through the pregnancy phase, in order to prevent the mother as well as the fetus or the neonatal from these diseases. So it is given in a combination, as I have previously said, the 5 doses, that is at 2, 4, 6, and 8 months of age, and then again at 4 to 6 years of age. But when the child reaches the 7 years of age, then with the booster dose of every 10 years, then there is a 10 years time interval period is required. There is no need to take the doses with 2 years or 3 years interval. There is a 10 years time period. Then in the pregnancy time period, the 27th and the 36th week is essential for this vaccination, not below this. So you can say that the time period that is near the labor or delivery time, that is the 36th week. So this vaccination should be given over this time period. Now moving forward, here is lots of shorts diagram. As you can see that the first till fifth dose, how they are going to given that first dose in the 2 months of age, second for 4 months, third for 6 months, and so on, and the fifth for the 4 to 6 years. But after that, 10 years of time period interval is required. Okay, now so here it is the drug-drug interaction. So drug interactions may change how your medications work or increase your risk for serious side effects. So firstly, you have to keep all the products that you are using right now, like the prescription or the non-prescriptional drugs or the herbal products that you are using for your diseases, for your viral infections, and firstly share it with your healthcare professional. Do not start, stop, or change the dosage form of any medications without your doctor's approval. So there is not basically like main drug-drug interaction of this vaccine, but the drugs like cyclosporine, tacrolimus, cancer chemotherapeutic agents, and corticosteroids like prednisolone, or methylprednisolone, or the recent vaccines. Here we can quote the recent vaccines like COVID-19 vaccine. So these may cause some sort of drug-drug interactions, but the research is going on with these recent vaccinations, but not a harmful drug-drug interaction has been reported in any type of the tetanus diphtheria vaccine. Then towards the drug toxicity, as I have previously mentioned, that there is no much damaging or serious side effects of this vaccine, but you can see that there are joint pain, muscular ache, pain, itching, swelling, exhaustion, the dizziness, and vision abnormalities or ringing in the ears, that is tingling sound. Some people may face these symptoms, but they are actually like they have a fear. Some people that have a fear of injectables, they can also face these symptoms. So you can relate that these symptoms are not actually due to the drug, they are actually due to the fear they are having. So there are not such drug, or you can say vaccine side effect. Then if the person is facing, then what should be the antidote for it? So in the next slide, antidote. So antidote, coming towards the antidote, so there is no such antidote for the tetanus poisoning, while the signs and symptoms can be reversed by treating with an immunoglobulin, that is IVIG, that is intravenous immunoglobulin. It is actually an antibody that binds to the specific protein, especially with the albumin, and helps in neutralizing the tetanus toxins, which are not going to bind with the muscles, so preventing it futurely, means in the upcoming muscles activation prevention. So here are some classes of antibiotics. Though there is not a real antidote for tetanus vaccine, but the some antibiotics class like cephalosporins, macrolides, and type macrolides antibiotics can be used to kill the Clostridium tetani, that is actually the main root bacteria that produces the tetanus. And usually we give metronidazole, and other than this we give penicillin G with the doses depending upon the patient's conditions. And for precautions, previously I have said that if you have facing any sort of symptoms, any sort of signs like fever, then you have having and you and your child having any sort of reactions, allergic reactions, anaphylactic shocks, paralysis, encephalopathy, excessive drowsiness, then you have to immediately consult to your physician, to your doctor, that why it is happening and what's going on inside your body. Now, coming towards the case study, a 21-year-old vaccinated male is presented with generalized body stiffness, breathing difficulty, as well as inability to chew and swallow food for 4 days. His symptoms started as difficulty in chewing solid food due to the heaviness sensation. And he also had slurred speech. 18 days before his presentation, he was injured by two nails while working at a construction site. After the multiple visits to the hospital and from the diagnosis, stress to muscular pain has been achieved due to labor and functional disorder. And vital signs are normal except for tachycardia. That is not normal. At 110 per minute, heartbeat is not normal. And on admission, he was hydrated with dextrose DNS and was developed with frequent spasms and excessive sweating. Now, for summarizing all this case study and presenting it in the form of SOAP notes. So here we'll start firstly with the subjective, that the chief complaint of the patient is body stiffness, breathing difficulty, inability to chew and swallow, slurred speech, spasms, and excessive sweating. He is facing all these symptoms 4 days for 4 days. So the duration of complaint is 4 days. And disease history, as he is facing tachycardia, not more than this other diseases, current medication with DNS, employment status, and then environmental history, that 18 days before he got injured with two nails while working over the construction site. It means summing up the 18 days and the 4 days from where he has established these symptoms. So overall 22 days he has been suffering with the injury. So now what should be the objective? Like there's a stress and muscular pain due to labor, functional disorder, autonomic instability, and deteriorated respiratory function from diagnosis. From diagnosis, we have achieved that all these body stiffness, breathing difficulty, our visual test has been done, and from diagnosis we came to know up here. Heartbeat or heart rate is 110 per minute. That leads to the tachycardia, which is not normal. And over admission, over the exposure of dextrose with normal saline, his body leads to the excessive sweating and frequent spasms are there. So what is actually the assessment for him? Like firstly, he got injured 18 days before and is suffering from respiratory dysfunction, difficulty in chewing and swallowing food. How if someone got injured with any sort of iron or steel material and then all of a sudden got a respiratory dysfunction and difficulty in chewing and swallowing food? Obviously there has been some sort of medical history that's going on inside his body. So in the start of the case study, it is being mentioned that he is a unvaccinated person, unvaccinated of diphtheria tetanus vaccine. So that's why we can easily determine and we can easily evaluate that all the previous complaints that he has stated are giving a clear clue, are giving a clear sign towards his weak immunity. That's why he is suffering from all these symptoms, all these dysfunctions. And also, when he received the dextrose with normal saline over admission in hospital, he got frequent spasms and excessive sweating, obviously due to his weaker immunity and current condition of his body. So according to this scenario, he needs to be admitted in hospital for at least 7 days in under observation, or if his condition is not going to be stable, then more than the 7 days his admission is required. So for this purpose, I have a plan that is regarding medications. Like for his current condition, our first line of treatment will be metronidazole, that is 500 mg IV 4 times a day. 4 times a day means dividing 24 hours with 4 leads to 6 hours, means every 6 hourly, along with diazepam IV 10 mg 3 times a day. And in this scenario, over this condition, he must be urgently vaccinated with the first dose of tetanus diphtheria vaccine. For the spasms and excessive sweating that he has been achieved along with the DNS, that is dextrose solution, so we will be giving him magnesium sulfate 5 gram IV with the paracetamol up to 10 gram per day in the divided doses, not all of a sudden or all of a sudden, like not immediately, but depending on his condition, if he got fever or not, then in the divided doses like SOS we can give give him. So with all these medications, he'll surely get stable by the second week of admission, and after that he'll going to be discharged out with complete monitoring of him. Before this, he has to be under observation. And regarding the tetanus diphtheria vaccine doses, as it's not a single dose vaccine, so urgently he has received the first dose of TD vaccine. So the second dose will be given at the 35th day from comparing with the first day. And then same vice versa for the third dose. Here I'm not talking about the 5 doses as they are given for the infants. So he is a younger 21-old male. That's why 3 doses are required. So there is no actually such a special follow-up need up. So that's why there is no need to come up for the follow-up procedure until and unless there are some other complaints, and he has to follow up the chart regarding his second and third doses of the TD vaccine, because vaccination has to be done in all the doses, not going to skip any of them. Otherwise, it can lead to other symptoms regarding the body. So that's it. Here are some of the references from where I have sum up my presentation, and here you can see them. That's it from my side. Thank you so much.